kind of alarming what's going on here in the state of Michigan right now. We have the highest rate of coronavirus infections here in the state of Michigan compared to every other state in the country. The surge is scary for so many people. And to talk a little bit more about this and so many other things, let's bring in Dr. Chen. She is the Chief of Medicine over at Henry Ford West Bloomfield. Doctor, thank you again for being with us.
Good morning. Thank you for having me here. It's a pleasure.
So as someone who is on the front lines, what is it like every day? We're a year into this. So many workers, you must just be exhausted.
You know, it has been a battle, and there have been ebbs and flows, and we were doing quite well in the state of Michigan, you know, about 2 months ago. And then I think a series of events that all came together have all contributed to the spike that we've seen now. And the numbers we have now are as high as we've ever had. And that's one of the most concerning things when you think about how we're doing. And I think it caught many of us people in the state by surprise, I would say. I'm not sure it was anticipated that this was going to be upcoming at this time. But I think we're ready for anything now.
Yeah, it's been a roller coaster ride. The one thing that is better, if there is, a silver lining in all of this, it's not the struggle that it was a year ago to get PPE and some of the other equipment needed. Absolutely.
As healthcare providers and at Henry Ford, we've gained so much knowledge, especially in the beginning a whole year ago. And so our expertise and, all the care providers in the state, expertise in taking care of COVID is very high at this point. There still is the emotional toll of seeing our patients and our loved ones critically ill, and that's been hard.
So with that, Doctor, do you want to talk a little bit about if someone is coming to the hospital right now? Are restrictions in place right now at Henry Ford?
Yes, in most facilities, we are limiting guests. We are not allowing visitors due to, again, COVID numbers being as high as they've ever been, even higher than the beginning of the pandemic. So just for safety for everyone, and not everyone in the population is immunized. So we do know that there is risk with some visitors potentially being a carrier of COVID, having asymptomatic COVID, or having symptomatic COVID. We just want to keep everyone safe.
Dr. Chen with us here on the MegaCast. She's the Chief of Medicine at Henry Ford West Bloomfield Hospital and also an infectious disease specialist. As a doctor, what is your take on the virus and how it is spreading across the country right now?
Well, it's been devastating and has caused a pandemic, one we've not seen in almost 100 years. What we've seen more lately are new variant strains that have emerged in the last 6 months. And unfortunately, one of those strains, the B117 from the UK, has made its way not only to the United States, but to Michigan. And you may have heard or seen, we have some of the waffling between number 1 and number 2 of the most cases of this new strain in the country. These new variant strains are thought to actually be more infectious, so they spread more quickly and actually cause more severe disease, more severe cases of COVID. So while we are evolving and our best practices have continued to be fine-tuned and honed, the virus also is adapting and trying to evade everything we're throwing at it. So it's been a struggle, but one that we keep working at.
So with that, Doctor, we hear so much about herd immunity throughout this pandemic and this crisis. Can we reach it, or will the variants always have us striving to reach it?
I believe, in theory, we could reach herd immunity. And as you know, herd immunity, it's also called population immunity. It's when there is indirect protection from the COVID disease, when a very, very high percentage of the population is immune to COVID, either through vaccination or if we develop immunity through prior infection. Now, the World Health Organization and the CDC feel that it's unethical to let COVID ravage the community and develop immunity through infection. We would lose many, many millions of more lives that way. So we are trying, as you mentioned, trying to reach herd immunity through vaccination. So there's several barriers towards reaching herd immunity. We do have the new variants, but we have excellent science, and we are able, even our current vaccinations are thought to be somewhat or pretty active against the variants. But my concern actually of the barriers that would prevent us from reaching herd immunity are other things as well. So we know that until everyone reaches herd immunity, we actually have to be careful with social distancing and following the rules. And many people have relaxed that vigilance, and we haven't reached herd immunity. So it's actually spreading the problem more quickly. So we're actually doing worse now than we were even before vaccination, because we have let down our guard and we haven't kept up that vigilance while we're waiting for everyone to get vaccinated. But I think the number one thing I'm most concerned about is that what we call vaccine hesitancy. There are many, many adults who have been offered the vaccine and who have declined. And so it simply is not going to be possible to reach any sort of herd immunity or protection for the entire population if almost everyone doesn't agree to take the vaccine. Current experts estimate the need for vaccination to range anywhere from 70 to 90% of the population needs to get immunized. And when you think that, 20% of our entire population are children, that would essentially mean almost 100% of our adults would need to get immunized. And we are so far away from that, even that acceptance of needing immunization and agreeing for immunization due to many different reasons. And so I actually think that is our biggest barrier. If we could convince everyone about the safety and the need to protect everyone through vaccination, and that's our best way towards returning to normalcy in the future, a better life for all of us in the future, we would have a better chance of achieving herd immunity.
So if the Pfizer vaccine gets approved by the FDA for emergency use for kids that are 12 to 15, do you think that would help us as a community try to reach this level?
I do think it would help. And absolutely. If you look now at one of the many driving forces of increasing the rates in Michigan, why we're number one or number two in the country for number of new cases as well as percentage of positive cases, it's the younger population. Anywhere from, we're seeing outbreaks in daycares, but every age group, 10 to 20, 20 to 30, 30 to 40, 40 to 50-year-olds, this entire younger population is driving the number of new cases. Early in the pandemic a year ago, most of the cases were in our most vulnerable elderly population. But many of those patients have now been immunized, and so the COVID infection has now spread towards the people who are not immunized, which is essentially everyone under 50, and even many 50 to 60-year-olds, but 50 and under is where the driving force is right now with new cases. And so by being able to immunize everyone, even down to 12-year-olds, hopefully in the future, near future, I think that would help prevent the spread within our community.
Dr. Chen with us here on the MegaCast. She's the chief of medicine over at Henry Ford West Bloomfield Hospital. And with that, doctor, I have to ask, because every time I go on social media, it is like everyone is either in Florida or Tennessee or Texas. I mean, they're all traveling, even some people crazy enough to go to Mexico right now. But we're hearing like some of those states don't have the numbers that we have here in Michigan, and they don't have the restrictions, and they've lifted their mask mandate. What would explain why some of those states have such different numbers than Michigan?
That's a great question. I think for the spike in Michigan is a combination of 4 or 5 different things. As we mentioned earlier, the new variant strain, Michigan has some of the highest or second highest case in the country of new variant strains. And this new B.1.1.7 variant is much more infectious, spreads much more quickly. So we have that issue. I do feel it's hard to say whether we have more fatigue than other states, but I certainly see it in Michigan that we're not being as vigilant with masking and social distancing. You think about everyone sheltering in place a year ago, and certainly I'm not suggesting we shelter in our homes, but I think just even following social distancing and masking, there's a lot of fatigue and people are just tired and they're not being as vigilant. I think that we've opened up us socially to a pretty big degree. So, we've opened up restaurants up to, I believe, 50%. We mandated that schools be open potentially full-time for all children. We've opened up spring sports. So we have seen spread in the younger populations. And again, that's probably not unique to Michigan. I think that we did such a great job the second half of 2020. I think the governor was very cautious and worked very hard to try and prevent the loss of more lives. So we were shut down significantly in the second half of 2020. And so that protected a significant part of the population. And so it actually, by us opening everything up so quickly, perhaps a bigger proportion of our population was more vulnerable right now because we hadn't had infection, thankfully, in the past as much as we could have. And now that if people are not masking and social distancing, and the virus has entered our younger population. So kind of a perfect storm with it being spread very aggressively in our community. All of these things together have probably pushed Michigan to the forefront.
So basically, the states that didn't have the same restrictions, more people had it in the beginning, but they didn't have the variant that is more contagious that we're seeing here in Michigan?
Well, I don't want to make too much of that, but it is possible that we have a little bit, we had more protection, or we weren't as vulnerable back then, but we are more vulnerable now. But I do think the 4 or 5 other factors that I mentioned also contribute. Us having the highest number of variant cases, the variant being the most infectious, us opening up socially, at the same time this was all happening kind of led to a perfect storm. So I think that was what you point out as maybe one of 5 factors that all contributed.
Right, and everyone is traveling like crazy right now.
That's absolutely true. And we've seen it in the school systems where, the week after spring break, there's been an explosion of cases. So, and it's not just the schools. We've seen an explosion of cases in everyone under 50. So it's been tough.
Dr. Chen with us here on the MegaCast. She's Chief of Medicine at Henry Ford West Bloomfield, but also an infectious disease specialist. Doctor, if we can jump ahead to like a month, what are your predictions? If everyone gets the shot that can get the shot, will we be working our way out of this pandemic?
I think right now is a really critical time. I'm not sure that the state of Michigan and everyone here understands how severe things are and how careful we really need to be and vigilant for the next 2 months. We've actually increased our number of cases for 7 straight weeks, and that's record-breaking in a bad way. So we really have to all come together right now in this upcoming month and practice social distancing until we can all get vaccinated. And as you know, it's, whether it's 1 shot or 2 shots a month apart. So I do think that in the next 2 or 3 months, a much greater proportion of Michigan could become vaccinated. And I think hopefully we can encourage everyone to take that opportunity to protect themselves and their families and their loved ones by doing that. And I think until we can make that happen, I would strongly encourage everyone to be really vigilant because we are actually reaching a really critical point now where people are the rates are astronomical, and we see so many hospitalizations, critically ill people, except now they're young and critically ill, and that's equally devastating.
So what about the treatment? In the beginning, we were hearing so much about plasma being used as one of the treatments. We're not really hearing too much about that. Should people still be donating like they once were in the beginning?
Actually, yeah, you're right. The data with and we have so much more data now than we did a year ago. A year ago, it was a great theory, but now we've got many scientific publications suggesting that the convalescent plasma is not very helpful. What we have found very helpful is that people who are early in their COVID infection, actually, there's only one treatment at this time if you're not critically ill and you're outside the hospital and safe to be at home, and that's monoclonal antibody. And that has shown some good results, scientifically proven. And we are giving that to patients who are, we call high risk. If you're more elderly, if you have coexisting conditions, diabetes, immunocompromised, obese. So that would be one option for people to strongly consider. I would strongly say you actually should not be taking steroids at home if you're not critically ill and short of breath and hospitalized. Really, steroids should be reserved for people who are hospitalized, because that is a really common error we are seeing by primary care providers and urgent cares in the community. And then, of course, if you have symptoms, I would urge the listeners, if you have any kind of symptoms of shortness of breath, feeling a little more short of breath when you walk, you urgently need to be evaluated for possible admission and treatment in the hospital, where most of our treatments are given.
So with that, Doctor, when we're talking about the vaccine, there's still that debate out there between the different types of vaccine. It's been around long enough now. We know some people have side effects, some people don't. But do you think for us to really get to our herd immunity, doctors, our primary care doctors, need to start getting the vaccine to be able to give to their patients as well?
That would be great in an ideal world. We simply don't have enough as a nation to be able to distribute it to offices. Even hospitals are being given a limited amount. Really, the state is, distributing it in mass centers such as Ford Field and the health department, and through pharmacies is the way that they've chosen to go, which I understand that's accessible to everyone. So yes, in the ideal world, that would help speed up immunization, but really we're limited right now with the number of vaccines available, and we are working hard to distribute everything that's available through the channels that we just mentioned.
You're listening to 89.3 WBLD Orchard Lake, 88.1 WBFH Bloomfield Hills. With that, Doctor, we want to remind people, because some people want one shot versus the other shot, the best vaccine is just whichever one you can get.
100% agree. All three vaccines are excellent. All three are very effective. All of them help prevent serious hospitalizations and deaths, which is the most critical point. So any of the vaccine that you can get, you should jump at the chance.
Doctor, anything else maybe I didn't ask that you want to chime in on before we say goodbye?
I would just like to end with this. We worked so hard as a state and a country for 1 year to do all the masking and social distancing, and made so many sacrifices socially, economically, to do that. And actually, I'm not sure if everyone realized, but it was for one goal. It was so that everyone could get vaccinated and we could get protection and what you call herd immunity or community immunity through vaccination. So I would strongly encourage everyone, until you can get your full immunization, to please continue practicing safety. And I would please ask everyone to strongly consider getting vaccinated, because if we don't come together and get vaccinated as a country, all of these sacrifices the past year have been for nothing. And so really it's been to this driving point. We made these sacrifices for a year, and we've been working hard to try and save as many lives. And now we all need to get vaccinated so we can, have a safer future. So
I know that there's been, you probably don't know this, we don't know this yet. Do you anticipate this is going to be kind of like the flu shot, where we get it, usually annually, or could this be every 6 months, every year?
Yep, that's a great question. And I think there is a possibility that we're all considering that this might need a booster in the future, whether it's annually. I think more information is going to be known. And that's exactly what they're studying now. Now that we're getting vaccinated, they're studying patients to see how long do we have the antibody, how long would we be protected for. So I think more information to come. But I know our country is one of the most prepared in the world. So we're very lucky to have the resources we have here. And so I know that we'll be able to protect the country if everyone can agree to get vaccinated.
Well, I'm sure you're vaccinated. And so, Sam Adams is getting in on trying to encourage people to get the vaccine. So if you post, and hashtag shot for Sam, you could get a free beer out of this. And I think all of you on the front lines, you all deserve it and you probably need it.
Thank you.
Well, thank you again for being with us. We always appreciate your time.
Thank you. It's a pleasure.